Which of the following is a benign tumor? A. Osteosarcoma. B. Chondrosarcoma. C. Fibroma. D. Neuroblastoma. E. Adenocarcinoma. The answer is C. Fibroma. A fibroma is considered a benign fibrous tissue tumor. The other tumor types are all malignant. What is the most common soft tissue tumor in children? A. Rhabdomyosarcoma. B. Desmoid tumor. C. Neuroblastoma. D. Epithelioid sarcoma. The answer is A. Rhabdomyosarcoma. The most common soft tissue tumor in children is rhabdomyosarcoma. This generally presents on the face, neck, or extremities, with nearly 1/3 of cases presenting with orbital involvement. 90% of all cases of rhabdomyosarcoma are seen in children, most often seen in children under 10 years of age. Leiomyosarcoma, epithelioid sarcoma, and desmoid tumors are all relatively rare soft tissue tumors of childhood. The nursing student prepares a report on acute versus chronic leukemia. Which of the following assessments is correct? A. Acute leukemia has a gradual onset and often occurs among children and young adults. Chronic leukemia has a rapid onset and often occurs among those aged 25 to 60. B. Acute leukemia has a rapid onset and often occurs among those aged 25 to 60. Chronic leukemia has a gradual onset and often occurs among children and young adults. C. Acute leukemia has a rapid onset and often occurs among children and young adults. Chronic leukemia gradual onset and often occurs among those aged 25 to 60. D. A rapid onset and often occurs among children and young adults. E. None of these. The answer is C. Acute leukemia has a rapid onset and often occurs among children and young adults. Chronic leukemia has a gradual onset and often occurs among those aged 25 to 60. To answer this question, it is essential to 1. Identify the correct definition of acute conditions versus chronic conditions, and 2. Identify the age groups that experience acute leukemia versus chronic leukemia. Acute conditions such as acute leukemias have rapid onsets, while chronic conditions such as chronic leukemias have gradual onsets. Acute leukemias are more common among children and young adults, while chronic conditions are more common among adults aged 25 to 60. Which of the following types of kidney tumors occurs most frequently in children? A. Renal oncocytoma. B. Chromophob cell carcinoma. C. Wilms tumor. D. Metanophricadenoma. The answer is C. Wilms tumor. Wilms tumor, also known as nephroblastoma, is a rare type of malignant tumor that occurs primarily in children. These tumors tend to be unilateral, and will present as an abdominal mass with abdominal pain or tenderness, nausea and vomiting, and fever. 20% of cases will also present with hematuria. With what co-infection is Burkitt lymphoma associated? A. Hepatitis B. B. Cytomegalovirus, CMV. C. Epstein-Barr virus, EBV. D. Herpes simplex. The answer is C. Epstein-Barr virus, EBV. EBV infection is common in Burkitt lymphoma. In malaria endemic areas, it is thought that the cancer is actually caused by chronic malarial infection, increasing a person's susceptibility to chronic EBV infection. The same is assumed about HIV co-infection with EBV in the United States. None of the other infections listed are associated with Burkitt lymphoma.